Hi guys, welcome back to the channel Basic Home First Aid. Today, we will be looking at the easiest and most effective steps to carry out CPR on a child. If you haven't checked out our previous video on carrying out CPR on an adult, the link will be put at the end of this video. Before we go any further, please don't forget to share, subscribe, and give this video a big thumbs up. Unfortunately, knowledge on adult CPR does not qualify you to perform CPR on a child or infant, as the procedures differ owing to the size and fragility of their vital organs. We'll begin the procedure by checking if the area is safe. Then, check the child's responsiveness by calling their name loudly and firmly squeezing their toes. Any movement or noise made is regarded as a response. If there is no response, the child is unconscious and in danger of dying due to their airway becoming blocked, and if breathing stops, the heart soon stops. The immediate thing to do is to call for help using your country's emergency number before beginning any intervention. Place the child on a firm flat surface and kneel beside them. Then, check the child's mouth for air blockages like the tongue, food, or vomit. If there are any, use your finger to clear it. If the child is under 1 year, place the child on their back on a neutral position with the head and neck in line, and slightly lift the chin using your fingertips. For a child over 1 year, open the child's airway by gently tilting the head and lifting the chin, assuming the child had no injury to the neck. Next is to check if the child is breathing normally, which is done by looking for chest movements and listening for breath sounds. If there is no or abnormal breathing, begin with rescue breaths. For a child under 1 year, cover the child's mouth and nose with your mouth, ensuring it is sealed. Then blow steadily into the child's mouth and nose over 1 second. Check to see that the chest rises. For a child over 1 year, pinch their nose and seal your lips over their mouth, then breathe steadily over 1 second. This sequence should be repeated 4 more times. Then, look for signs of life, such as movement, coughing, or normal breathing. If there are definite signs of life, continue rescue breaths until the child begins to breathe normally on their own. If there are no signs of life, start chest compressions immediately. For a child under 1 year, place 2 fingers at the center of the chest, just below the imaginary line between the nipples, and push down by about 4 centimeters, allowing the chest to return to its normal position after each compression. For a child over 1 year, place the heel of one hand at the center of the child's chest. You can interlock your fingers in bigger children and push down by about 5 centimeters, ensuring your shoulders are directly above your hands. After 30 chest compressions, give 2 effective rescue breaths. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life or until medical assistance arrived. Thank you so much for watching till the end. Please don't forget to like, share, and subscribe because we have great content ahead. And always remember, if not you, who?